What are the lung diseases affecting the airways? Lung diseases affecting the airways often involve inflammation, narrowing, or obstruction of the bronchial tubes, which are the air passages that carry air to and from the lungs. These conditions can result in symptoms such as coughing, wheezing, shortness of breath, and difficulty breathing. Here are some common lung diseases affecting the airways. 1. Asthma. Asthma is a chronic inflammatory condition characterized by reversible bronchospasm, constriction of the airways, inflammation, and increased mucus production. Triggers such as allergens, exercise, or respiratory infections can lead to asthma symptoms, including wheezing, coughing, chest tightness, and shortness of breath. 2. Chronic bronchitis. Chronic bronchitis is a type of chronic obstructive pulmonary disease, COPD, characterized by long-term inflammation of the bronchial tubes. Symptoms include a persistent cough with sputum production, frequent respiratory infections, and difficulty breathing. 3. Emphysema. Emphysema is another form of COPD that involves the destruction of the air sacs, alveoli, in the lungs, leading to decreased elasticity and air trapping. Common symptoms include shortness of breath, chronic cough, and reduced exercise tolerance. 4. Bronchiectasis. Bronchiectasis is a condition characterized by abnormal widening and scarring of the bronchial tubes, leading to the accumulation of mucus and recurrent infections. Symptoms include chronic cough, production of large amounts of sputum, and respiratory infections. 5. Bronchiolitis. Bronchiolitis is an inflammatory condition that primarily affects the small airways, bronchioles, often seen in infants and young children. 6. Respiratory syncytial virus, RSV, is a common cause of bronchiolitis, leading to symptoms like cough, wheezing, and difficulty breathing. 7. Bronchospasm. Bronchospasm refers to the sudden and involuntary contraction of the muscles surrounding the bronchial tubes, leading to airway constriction. Conditions like asthma and some forms of chronic bronchitis can result in bronchospasm, causing symptoms such as wheezing and shortness of breath. 8. Tracheobronchitis. Tracheobronchitis is inflammation of the trachea and bronchi. It can result from viral or bacterial infections and is often associated with symptoms like cough, chest discomfort, and throat irritation. These lung diseases affecting the airways can be caused by various factors, including environmental exposures, such as smoking or air pollution, genetic predisposition, infections, and autoimmune processes. Management often involves bronchodilators, anti-inflammatory medications, and lifestyle modifications to control symptoms and improve lung function. Early diagnosis and appropriate treatment are crucial for effectively managing these conditions. What are the lung diseases affecting the air sacs, alveoli? Lung diseases affecting the air sacs, or alveoli, typically involve damage to the delicate structures responsible for gas exchange. This can result in impaired oxygen uptake and carbon dioxide elimination, leading to respiratory symptoms. Here are some common lung diseases affecting the air sacs. 1. Pneumonia. Pneumonia is an infection that causes inflammation of the air sacs in one or both lungs. It can be caused by bacteria, viruses, fungi, or other microorganisms. Symptoms include fever, cough with sputum production, chest pain, and difficulty breathing. 2. Emphysema. Emphysema is a type of chronic obstructive pulmonary disease, COPD, characterized by the gradual destruction of the walls of the alveoli. This leads to the formation of large, less efficient air spaces and reduced surface area for gas exchange. Symptoms include shortness of breath, chronic cough, and reduced exercise tolerance. 3. Chronic bronchitis. Chronic bronchitis, a component of COPD, involves long-term inflammation of the bronchial tubes and can affect the air sacs. Chronic bronchitis can lead to increased mucus production, airway obstruction, and damage to the alveoli. 4. Interstitial lung disease, ILD. ILD comprises a group of disorders characterized by inflammation and scarring of the lung tissue. including the interstitium, the space between the air sacs. Conditions like idiopathic pulmonary fibrosis, IPF, lead to fibrosis and thickening of the interstitium, affecting the alveoli and impairing gas exchange. 5. Acute respiratory distress syndrome, ARDS. ARDS is a severe and sudden lung condition that can occur in response to injury, infection, or other triggers. ARDS leads to widespread inflammation, fluid accumulation in the air sacs, and impaired gas exchange. It often requires mechanical ventilation. 6. Occupational lung diseases. Certain occupational exposures, such as to asbestos, silica dust, or coal dust, can lead to lung diseases affecting the air sacs. For example, pneumoconiosis, a group of lung diseases caused by the inhalation of mineral dust, can lead to fibrosis and damage to the alveoli. 7. Alpha-1 antitrypsin deficiency, AATD. AATD is a genetic condition that can lead to the development of emphysema. The deficiency of the alpha-1 antitrypsin protein allows destructive enzymes to damage the alveoli. 8. Lung cancer. Lung cancer can affect the air sacs as tumors grow and invade lung tissue, compromising the normal structure and function of the alveoli. 9. Granulomatosis with polyangiitis, GPA. GPA is a rare autoimmune disease that can cause inflammation of blood vessels and the formation of granulomas, affecting the air sacs and leading to respiratory symptoms. These diseases can have varying causes, including infections, environmental exposures, genetic factors, and autoimmune processes. Early diagnosis, appropriate treatment, and management strategies are essential for addressing these conditions and preserving lung function. What are the lung diseases affecting blood vessels? Lung diseases affecting blood vessels often involve disorders that impact the pulmonary vasculature, including the arteries and veins within the lungs. These conditions can lead to impaired blood flow, increased pressure in the pulmonary arteries, and compromised oxygenation. Here are some lung diseases that primarily affect blood vessels. 1. Pulmonary hypertension. Pulmonary hypertension is a condition characterized by elevated blood pressure in the pulmonary arteries. It can result from various underlying causes, including idiopathic pulmonary arterial hypertension, IPAH, connective tissue diseases, and chronic lung diseases. Symptoms include shortness of breath, fatigue, chest pain, and, in advanced stages, right heart failure. 2. Chronic thromboembolic pulmonary hypertension, TEPH. TEPH is a specific form of pulmonary hypertension caused by chronic blood clotting in the pulmonary arteries. Blood clots, known as thromboemboli, can obstruct blood flow and lead to increased pressure. Symptoms are similar to those of pulmonary hypertension and may include shortness of breath and chest pain. 3. Pulmonary embolism, PE. While not a chronic lung disease, a pulmonary embolism is a sudden blockage of one or more pulmonary arteries by a blood clot, usually originating from the veins in the legs. Symptoms include sudden onset of shortness of breath, chest pain, and rapid heart rate. PE is a medical emergency. 4. Vasculitis-associated lung diseases. Certain systemic vasculitis, such as Wegener's granulomatosis, now known as granulomatosis with polyangiitis or GPA, and the eosinophilic granulomatosis with polyangiitis, EGPA, can affect blood vessels in the lungs. These conditions may lead to inflammation, damage to the vessel walls, and, in severe cases, pulmonary vasculitis. 5. Pulmonary arteriovenous malformations, PAVMs. PAVMs are abnormal connections between pulmonary arteries and veins that bypass the capillaries. This can lead to shunting of blood, reducing oxygenation. PAVMs may be associated with hereditary conditions like hereditary hemorrhagic telangiectasia, HHT. 6. Pulmonary veno-occlusive disease, PVOD, and pulmonary capillary hemangiomatosis, PCH. VOD and PCH are rare conditions affecting the small veins and capillaries in the lungs. They can lead to increased resistance in the pulmonary vasculature. Symptoms include shortness of breath and pulmonary hypertension. 7. Hypertensive pulmonary vascular disease, This term encompasses various conditions where increased pressure in the pulmonary arteries results from underlying heart or lung diseases, such as chronic obstructive pulmonary disease, COPD, or left heart failure. 8. Pulmonary hypertension due to lung diseases. Chronic lung diseases, such as interstitial lung disease, ILD, or chronic bronchitis, can contribute to pulmonary hypertension due to changes in lung structure and function. Lung diseases affecting blood vessels often require a multidisciplinary approach for diagnosis and management. Treatment may include medications to reduce pulmonary artery pressure, anticoagulation for certain conditions, and interventions to address underlying causes. Early detection and intervention are crucial for improving outcomes in these conditions. What are the lung diseases affecting the pleura? Lung diseases affecting the pleura involve disorders that impact the double-layered membrane surrounding the lungs known as the pleura. The pleura consists of two layers, the visceral pleura, governing the lungs, and the parietal pleura, lining the chest cavity. Conditions affecting the pleura can lead to inflammation, fluid accumulation, or changes in the pleural space. Here are some lung diseases that primarily affect the pleura. 1. Pleurisy, pleuritis. Pleurisy is inflammation of the pleura, often caused by infections, viral or bacterial pneumonia, autoimmune diseases, or conditions like pulmonary embolism. Symptoms include chest pain, which worsens with breathing or coughing, and may be accompanied by pleural effusion. 2. Pleural effusion. Pleural effusion is the accumulation of excess fluid in the pleural space. It can result from various causes, including infections, congestive heart failure, malignancies, or liver disease. Symptoms may include shortness of breath, chest pain, and a dry cough. Large effusions can compress the lungs, leading to respiratory distress. 3. Pneumothorax. Pneumothorax occurs when air accumulates in the pleural space, causing the lung to collapse. It can result from trauma, underlying lung diseases, such as emphysema, or spontaneously without an apparent cause. Symptoms include sudden chest pain, shortness of breath, and decreased breath sounds on the affected side. 4. Hemothorax. Hemothorax is the accumulation of blood in the pleural cavity, often due to trauma or injury to the chest. Symptoms include chest pain, difficulty breathing, and signs of blood loss. It can be associated with conditions like rib fractures or lung injuries. 5. Empyema. Empyema is a collection of pus in the pleural space, usually resulting from bacterial infections, such as pneumonia. Symptoms include fever, chest pain, and respiratory distress. Treatment involves drainage of the infected fluid. 6. Pleural thickening. Pleural thickening refers to the abnormal thickening of the pleura, often associated with asbestos exposure or chronic inflammation. It can restrict lung expansion and cause chest pain and breathing difficulties. 7. Mesothelioma. Mesothelioma is a rare but aggressive cancer that affects the pleura. It is strongly linked to asbestos exposure. Symptoms include chest pain, shortness of breath, and pleural effusion. Diagnosis is often challenging, and treatment options may include surgery, chemotherapy, and radiation. 8. Chylothorax. Chylothorax is the accumulation of chyle, lymphatic fluid, in the pleural space, usually due to disruptions or blockages in the thoracic duct. It can result from trauma, surgery, or underlying diseases and may cause respiratory distress. Lung diseases affecting the pleura often present with chest pain, difficulty breathing, and other respiratory symptoms. Diagnosis involves imaging studies, pleural fluid analysis, and sometimes biopsy. Treatment depends on the underlying cause and may include medications, drainage procedures, or surgical interventions. Early identification and management are crucial for optimizing outcomes in these conditions. What are the lung diseases affecting the chest wall? Lung diseases affecting the chest wall involve conditions that impact the structures surrounding the lungs, such as the ribcage, muscles, and soft tissues. These diseases can result in chest wall abnormalities, restrictive lung patterns, and respiratory symptoms. Here are some lung diseases that primarily affect the chest wall. 1. Kyphoscoliosis. Kyphoscoliosis is a deformity of the spine characterized by an abnormal curvature in both the sagittal, kyphosis, and frontal, scoliosis, planes. Severe cases can restrict lung expansion, leading to reduced lung volumes and impaired ventilation. 2. Obesity hypoventilation syndrome, OHS. OHS is a condition where obesity leads to hypoventilation, inadequate ventilation, resulting in increased carbon dioxide levels in the blood. Excessive weight can affect chest wall mechanics and compromise respiratory function. 3. Ankylosing spondylitis. Ankylosing spondylitis is a type of inflammatory arthritis that primarily affects the spine. Over time, it can lead to fusion of the vertebrae, reducing chest wall flexibility. Restriction of chest wall movement may contribute to respiratory difficulties. 4. Thoracic trauma. Injuries to the chest wall, such as rib fractures or blunt trauma, can affect lung function. Pain and limited chest wall movement due to trauma can lead to shallow breathing and decreased lung expansion. 5. Neuromuscular disorders. Conditions affecting the nerves and muscles involved in breathing can impact chest wall movement. Examples include muscular dystrophy, myasthenia gravis, and amyotrophic lateral sclerosis, ALS. Weakened respiratory muscles can result in reduced lung volumes and respiratory insufficiency. 6. Pectus excavatum and pectus carinatum. Pectus excavatum is a congenital deformity where the sternum and ribcage grow abnormally, creating a sunken appearance. Pectus carinatum is a deformity where the sternum protrudes outward. These conditions can affect lung function by altering chest wall mechanics. 7. Costis-sternal syndrome. Costis-sternal syndrome involves inflammation of the costis-sternal or costochondral joints, causing chest pain and discomfort. While not directly impacting lung function, the associated pain may affect breathing patterns. 8. Thoracic spine deformities. Certain congenital or acquired deformities of the thoracic spine, such as Scheuermann's disease, may affect the chest wall and limit respiratory function. 9. Chest wall tumors. Tumors arising from the chest wall or nearby structures can impact chest wall movement and lead to respiratory symptoms. These tumors may be primary or metastatic from other organs. Lung diseases affecting the chest wall often result in restrictive lung patterns, characterized by reduced lung volumes and impaired lung expansion. Management may involve addressing the underlying cause, providing supportive care, and, in some cases, interventions to improve chest wall mechanics. Respiratory rehabilitation and physical therapy can also play a role in optimizing lung function in these conditions.